I want to welcome everyone to our Friday features, our video section of our postings on social media and our website. I'm grateful to join us here today is Jennifer Watson from cultureoflife.org, a bioethics organization that promotes and educates and inspires all of us to really understand the issues that are facing us in the bioethics world. Also, Dr. John Bachowski, founder of Tepeyac OBGYN and Divine Mercy Care. And welcome to our inaugural Friday Features video.
Thank you, Will.
Thank you, Will.
It's an honor to be here with Dr. B.
No, this is a treat to be with you.
Yeah. Well, the wonderful part of this is it's really there's so many big issues that we're facing. And I think with any big issue we're looking at, it's trying to start from the foundation. What is bioethics versus ethics, and if you, Jennifer, could help us out with that in laying that groundwork.
That's a wonderful, wonderful question, because understanding bioethics, people tend to glaze over a little bit, and bioethics versus moral theology versus mores, and bioethics has an interesting history, which I'm sure some of us are familiar with, but most of the language in bioethics, or the naming of, calling the terminology of bioethics, really came about in the 40s after the Nuremberg trials, and all the different interventions that science and medicine was finding and discovering that they were, what the Nazis were performing on their subjects, sadly. And time of Pius XII, he had many discourses on the issue, but also here in the States, there was an incredible case in 41, I believe, Rose F. Kennedy, that became famous, and who needed a frontal lobotomy, if I recall. And the Kennedy family was Catholic, and the church didn't quite agree with some of the procedures and things they wanted to do, and so they started their own Center for Bioethics, which is now housed at Georgetown. And they came up with a new definition of bioethics. But bioethics really, there are several definitions floating out there. If you're Catholic, but if you're truly believe in that ethics are knowable, the definition was posed by Bishop Elios Grecha, then member of president of the Pontifical Academy for Life. And I will translate it for you in a short version, so it's not completely accurate, but bioethics is that part of science and medicine that deals with the interventions upon the human person, and those interventions upon the human persons that are deemed ethical or not ethical. And so when you're talking about bioethics, you're looking at who is our subject. It's the human person. It's not trees, it's not nature, it's not the environment, but bioethics deals with interventions upon the human person that stem from science and medicine, whether or not they're moral or not moral.
That's fascinating. It's a great groundwork and really a great transition even to Dr. B in how you see it in your history, as being a physician and probably every day, but really from your early stages of being a physician, how has it played into your formation and even till today?
Bioethics came up kind of organically in trying to learn about the human person, and also trying what you mentioned very clearly about the word definition. What I have found, because I have been on many sides of this issue, even though now we, respect the dignity of human life, we take care of two patients, mom and baby, and the dignity that flows from the genetic family of what it means to be a human person. If you remove the transcendent out of words, tenderness then leads to the gas chamber. So this century, 41, the Nazis, there were many, many people across the world who are very loving, caring, tender-hearted people. In fact, some would say that our last 150 years, we've had more tender-hearted people throughout the world. And a wonderful author that I love, Walker Percy, coined that phrase in his book, The Thanatos Syndrome, which I would recommend all you read. However, if you pull the transcendent out of the word mercy, it goes from respecting and walking with the suffering person to ending their life because their life becomes not worth. And that's why, for myself, organically as a doctor, I look to people like this to help me understand vocabulary in a world that's gone crazy.
Yeah.
And that's the real mess we're in. Because once again, we have many good people across the... Where do you look? Like, where do you look for advice?
Yeah.
Do you just go to intellectuals? Well, today, I'm reading another article today where patient autonomy is the only thing that matters in bioethics. Justice, beneficence, and all that. But it's patient autonomy trumps my autonomy as a doctor. So that's one end. The other end is, if you don't have a teaching office in your church, if you just go directly to Scripture, wait a second, they don't talk about embryos. They don't talk about, well, they kind of do. John leapt in the womb of Elizabeth. But what does that really mean? And I'm telling you that if you just go directly, good people can come up with totally different answers here.
Yeah.
Right.
And the reality is that human dignity is human dignity is human dignity. And that's why there's a great grace that the Church of the Catholic Communion has in the teaching office of the magisterium of the church. Because they take 2,000 years of history of this church, plus the years before that in the Old Testament, and come up with clear attempts at trying to guide us into making proper judgments to care for the least of our brothers and sisters, which in the end, that's the only thing we're going to be really judged on.
You made a really great point there, several great points, but I would argue that one of them that I think is so prominent today in a lot of different issues, politically and socially, is this idea of terms and where it comes from. And I'm thinking of an article that was not posted in our Friday features, but is one that's on at cultureoflife.org, your site, and it's this idea about the potency of these terms and the confusions around them. And stem cells is probably one of those that comes up. We it rears its head, and you're not sure. Well, wait, what does it mean now? It was always this embryonic stem cell scenario, but wait a second. There's other aspects and other stem cells that are being used. So if you could kind of allude on that,
sure.
Expand on it.
I'm happy to, because one of as we're dealing with CRISPR, all the different terms, CRISPR, germline editing, gene editing, and it's so much to take in. It's too much to keep up with, even if you're a physician, I'm sure. But one thing that is very frustrating for us as ethicists is that we're trying to educate people and say, look, these fundamental principles are so simple. You can apply them even to the most complex scientific endeavor or new development. But with when the terminology is constantly being misused or changed, it's very difficult. So one example, and thank you, Will, for bringing this up, and Dr. B, please jump in, is the use of the term adult stem cells. Now, in the 90s, or even when stem cells started coming back, we all thought adult stem cells, they can do so much good because they come from, there's the source of the cell is an adult human individual, such as, a somatic skin cell or other tissues. But what is being used now in the term adult stem cells also includes neural tissue cells. In fact, which are not even stem cells because they're already differentiated, right? So they're not technically not a stem cell. But an example would be here just a couple years ago, a cell technology company out of California, Stemedica, came out and they had given they'd injected these neural stem cells into two famed people, Gordie Howe,
Gordie Howe, the hockey player.
Yes.
And then a football player.
Yes.
Another one. Before my time, thank you. Anyway.
Not before my time.
Two very famous athletes, one from hockey, one from football, and who had suffered either injuries or had some serious neurological damage going on. And both of them experienced this wonderful recoveries. But come to find out, those, quote, stem cells, which for one, were not stem cells because they were cells that were already differentiated. And if a cell is already differentiated, that means it's basically unipotent. It can only be a similar cell in its own class, right? So it's no longer a stem cell. So there are 4 classifications of stem cells. One is totipotent, which is, let's face it, doesn't really exist. The other is pluripotent, which is what generally comes from embryonic stem cells. The other is multipotent, which are cells which tend to give rise to other cells in their own organ or their own type of tissue. But they can't give rise to all the different cells in the body. The other is unipotent, which is also not a stem cell. So totipotent and unipotent, the first and the last, are not stem cells because they don't give rise to other tissues. Multipotent is what. Well, let me backtrack a moment so I don't get anyone too confused. We're back to the adult stem cell issue. The stem cells, as you call them, they were using, came from the neural tissue of an aborted fetus, and they're calling them adult stem cells because the tissue they took them from was already differentiated. It already had specified into neural cells.
It goes
cell
back
tissue.
to language again.
It goes back to language again, exactly. But so what the best way to term these, and how we had termed them early on, were prenatal and postnatal sources of cells. So in the beginning, stem cells were referred to by their source, and that source being prenatal or postnatal. Or embryonic even. And what they're doing now is they're saying, oh, well, a somatic cell, which a neural cell is really a somatic cell because it's already become its own tissue, that it's already become what it's supposed to be. And it's not a stem cell, but they're calling them stem cells and they're calling them adult stem cells because the cell itself, they believe, has become an adult. It's differentiated. Mm-hmm. So rather than saying the stem cell came from an adult human being, which is why we had historically understood it, it's actually coming from aborted fetuses, and they're calling them adult stem cells because that cell is from matured tissue. Yeah. Terrible thing.
That's a great example of that hijacking of the vernacular, or just twisting of it, I think I would say. Doctor, in your practice, in your years of treating patients and helping women with a variety of issues, how have you seen the bioethic issues come up within the practice, within your medical experience?
It comes up every day because stem cells, I don't have direct experience with that, but I do have direct experience with embryos and blastocysts and the earliest forms of human life. And we have patients here who are really suffering with infertility. And once again, we also have people really here dealing with the issues of more children, less children, the desire to, the desire not to. And in medicine today, words keep changing. When does life begin? Well, back when I started, it was at fertilization. And then in 1973, the books changed. And it began at implantation. And then you began to realize that the contraceptive technologies, they began to blur that distinction, because if you believe that life begins at fertilization with the genetic complement, wait a second, then after it fertilizes, you can't prevent it from implanting. So they begin to blur, just like with stem cells, because once again, when Michael J. Fox comes on TV and says, you need to help me because I need embryonic stem cells. Well, over time, embryonic stem cells are prenatal. They don't work very well. They turn into tumors. And so right now, all the good data is coming from postnatal stem cells work. But when it comes to fertility issues, let me just give you one simple example. A young couple is struggling with infertility. And we are trying our best to cooperate and get drilled down to what is her cause? What's the cause? Because remember, fertility is a desire. It's not a disease. Children are not sexually transmitted diseases. But once again, when you start using language like this, I don't have to treat your blocked tubes. I don't have to treat your hormonal problems. I'll just go and make embryos. And then we will take one of those cells at the 5 or 4 cell stage. We'll take one out called pre-implantation genetics. And we will look at that and we'll say, oh no, this is a healthy one. This is not a healthy one. We'll grade them, A, B, F. Well, now we're telling a mother who has been hyper stimulated to make many eggs. We now make many embryos. And now we're telling her that some of her embryos are good quality, some are less than good quality. And you begin to lay the foundation for your child or your property. Now, this is where it affects me every day.
Right.
Before you go to IVF, folks, you got to ask the docs. And you have to ask your husband and your partner and who you are. Well, are those embryos they make, Jen, are they our kids or are they our property? Are they potential children, kind of like somewhere between an appendix and your little one?
Right.
Or is it your child full of potential? And it becomes really important here with language, because I see mothers who have frozen embryos who cry for them. They don't cry for appendixes. They cry for children.
Right.
And the one question that they have to ask, because it goes right back to this bioethics, it sounds so intellectual. It's not. It's visceral.
Very simple.
It's from the heart. And simplicity in science is judged genius, like Einstein, like Pascal. It's when they start complimenting it, when they start making it complex and start trying to put a wedge. So those embryos that are being made, that you're doing pre-implantation genetics on your child, do you love them or do you own them? And that's the question we ask clinically. We do our best to treat the disease and help people get pregnant. We do a very good job. But there are people who still want to go to IVF because they want it right away. And yeah, they're being promised 50, 70% success rates. Well, are those embryos they're making, are they your kids or are they your property? Do you love them or do you own them? Because if you love something, you don't usually freeze it, you don't usually waste it, you don't usually abuse it, you don't usually put back 3 to get 1. In fact, when you're dealing with that mother, with all those hormones, and her long history of not being able to have children, and then you subject her to this, and then, oh, by the way, if you have triplets, we'll just reduce them from 3 to 1, or from 3 to 2, by injecting something into the heart to kill it. Because it's really not your child yet. It's a potential. All of it. It goes right back to what she was saying. And that's how I see it in one example every day here in the office. And that's why it's so important to really think about, in a world where healthcare has gone stupid and everybody's being handcuffed with insurance and or ethics, or there is a part you have to come to a place of trust. Not only in God's will, if you are God, or fate, or whatever, but you also have to understanding with your physician, because they can use language that'll drive you anywhere that you want to go. Because once again, Divine Mercy Care, we believe mercy is compassion and caring for the least, maximizing the time of mothers spending with sick kids, not judging whether your child is good or bad, or getting rid of the disease by getting rid of the child with the disease. The hoot for me is, and the challenge is that how mercy has now become mercy killing.
Yeah. Yes.
And so remember, the words matter.
And dignity comes to mind right there. Dignity for the patient, the mother, and dignity for the patient, the baby in utero, right?
Oh.
It's all of that together. We talked about a couple of things there that really have been decades-old issues. The
Centuries.
Centuries, really.
Well, probably ever since Eve
Right.
had Cain and Abel.
Yeah.
And dealing with that. You're right.
Yeah. In transition a little, what are the bigger issues that are coming up now that seem to be sprouting there, whether it's for evil or for good, that people are wrestling with at the forefront of bioethics these days?
Human enhancement comes to mind, that temptation to really, to enhance our genome, which is risen from, just the different capabilities. CRISPR is one of them in gene editing, whether it be on somatic cells, germline cells, at the embryonic stage. People are saying, I would like to enhance, my children. I want to have, blue eyes, and I want to be 6 foot, and all these things.
Or they want
a
Harvard graduate, or whatever the case might be.
Right, whatever the case might be. But also, on their own, they're losing track of therapy, which I think Dr. B just very nicely says. When you lose track of therapy, you lose, and you put science at work in a disguise that's called medicine, a guise of medicine, which is not medicine at all, because medicine deals with therapy. It deals with the patient, all patients, both patients. In fact, taking back to the embryo, the term pre-embryo came up in the Davis versus Davis case in the 90s.
My professor invented it.
Oh, you're
Dr.
kidding.
Howard Jones.
No,
I was
you're kidding. Because it didn't come from scientific literature at the time.
And that's why pre-embryo really has never caught on.
Never.
Because the reality is it doesn't do what the embryo does justice. And we're doing pre-implantation genetics now on these pre-embryos, but we're telling you about your child. So what does that mean?
What does that mean?
It's not a pre-embryo, it's your child we're talking about, because I can biopsy your embryo at a few cells of age. No, he was my professor, Howard Jones. But you're spot on. No, continue, Jen.
No, but just to follow Doctor, it's fascinating because this Davis v. Davis, and I'll cap it as fast as I can. A couple, they go through IVF, and the woman was suffering. I mean, infertility
they were at our center.
Oh,
they were our patients.
I can't tell the story.
No, go ahead. No, tell it. You're
But, they're suffering. I mean, she's suffering, and I don't know if my husband and I went through it for a while, and but the women. So then they're it's a true. I mean, we should have a psychologist in here to explain what is going on in the woman, her psyche when she's infertile, because we are wired the same way we were when Eve existed, and we will always be wired the same. We're the same little human animal, right? But these poor husbands too, they're like, oh my gosh, my wife's driving me crazy, just give her whatever she wants. And they cave. Good people cave and go to IVF for these procedures rather than having a good physician such as Dr. Berchowski or the members here, really try and treat what is the cause of your infertility. But this case, so they ended up with all these frozen embryos. They divorced. Of course, they divorced. And so then she got past all of the hormone yo-yo, and she's like, oh my gosh, no, what have I done? I want my children. So she wanted to implant them, and she'd remarried, and he was in a different state in life, and he's like, no, you can't force me to be a parent. Well, they already were parents.
And that's the key.
Had already existed. But are you using these emotive terms? You can't force me to be a parent. Hello, you're already a parent. So then the term pre-embryo, well, but they're pre-embryos. They're not embryos yet. They're because they haven't been planted and da-da-da-da. And no, they're human.
Exactly. And that's been she's not talking about something theoretical here. We're talking about, because so many infertility centers biopsy embryos to get the genetics. Now remember, imagine this. So you're a mother that has the gene for a fatal neurological disease. And you have grown up in the Christian faith, and life begins at fertilization. But your husband doesn't quite get that. He just wants a baby, and you want your own. You don't want to go adopt, you want your own. And there's a technique out there that says we can look at your embryos that you make, and we can only put back the healthy ones. So watch what happens. Now the woman changes her mind because she wants to be with her husband. She may be in a Christian church that doesn't really have a lot of stuff to look at regarding embryos. Outside of the Catholic Church, Donum Vitae and Evangelium Vitae and some other place, there's no teaching, because it's kind of your interpretation. And then all of a sudden you go through it, and then your heart starts ripping, because now out of the 11 embryos you made, 5 have the mutation that are going to develop the disease. 5 don't. 6 don't. You get rid of the 5 that had the mutation because they're not really your kids yet. We have to save them from the suffering. So now you have 6 left, and now those 4 grow, and now you put some of those back, and then you go to your mother and you realize, as a mother, if my mother knew that her daughter, who has the mutation, she's trying to prevent this disease, would her mother have aborted her? Yes. So you have patients who are the walking wounded. Now once again, once the child's here, you say congratulations, because you got to engage them heart to heart. But what she's talking about is exactly the psychotic nature infertility, embryos, only putting back the healthy ones because that's what makes sense, right? Wait a second. My mother, would she have ended my life? Mm-hmm. And then how do you tell your children, or do you ever tell your children, that there were 5 of your other embryos in the same batch that you ended their life because they weren't healthy? Do you know psychologically what that does to the child? The survivor syndrome, the Titanic syndrome, just go down the list. And yet, infertility, the woman in Davis tears you up. You know, most doctors are trying to do what's right for people. But when it gets to embryos, if you don't have a teaching that tells you about terminology, that makes sense both viscerally and intellectually, and has a long history, you're lost. I can manipulate to tell you whatever I want. They're not your kids. They're your potential kids. They're not implanted yet, so they're not even real persons yet. That definition came up, but they made it up because it's a political definition. Yeah. Political, purely political. And yet they try to go back and do the science. No. You're biopsying pre-implantation genetics. CRISPR is being done on cells that are not implanted yet. And then the crazy thing is that we now can affect future generations without even knowing what that means. In China, they're doing CRISPR on people that are going to live, and they're going to pass on those genes. Well, wait a second. We have no idea what that means.
Right.
It's not just trying to fix a particular problem in the person, because it goes back to what she said about treatment. Right. We treat a person. I don't ask you to give to cover for someone else unless there's legal issues and things. You ought not do that if you can help it. But no, I think this is bioethics is life. And I really think that we have to listen and collaborate like this.
No, it's big. It's things that we need to continue to think about and wrestle about and talk like we are today, and to really to get people to be inspired to do that research. And I want to thank you, Jennifer, for coming today and really and all those out there. It's really. Thecultureoflife.org is Jennifer's website, and bioethics, and there's a vast wealth of resources there for you to dig into. Our website, divinemercycare.org, is another aspect for you to come to. So I think let's keep the dialogue going. Let's keep working, keep wrestling, and keep educating.
And send us your questions.
Yeah, absolutely. Yeah, please send us your questions. And also remember, even if you're not of the tradition of the Catholic Church,
right.
Absolutely look at those documents, because they're based on reason and 2,000 years of collective wisdom.
Plus 2,000 plus years, yes.
Yeah. Exactly. And so therefore, whether you agree or not, just get their opinion on this and see if it doesn't hang together. Because once again, you've got this dignity of the human person is all about love, as you said. It's about respect. It's about being part of your family. And so I'm grateful, Will, that you invited me.
No, well, thank you both, and may you have a wonderful Easter and remainder
Triduum.
The Triduum and Easter and the Easter season. Thank you so much.
Thank you very much.
Thank you.